Hi, I'm Dr. Michelle Feltis. I'm here with Dr. Joseph Becker.
Hello. We're both physicians in the emergency department at Stanford University.
In this talk, we're going to discuss the radiologic tests that can be used by healthcare workers in evaluating and diagnosing patients with COVID-19. We'll focus on the most common findings for COVID-19 on chest X-ray and CT scan.
The chest x-ray is, of course, a critical tool in the workup of the COVID-19 patient. Early in disease, chest x-ray findings may be very subtle or completely absent, and the chest film may be read as normal. On the left here, you see a normal chest x-ray. On the right, there is an x-ray that shows a relatively subtle right-sided infrahilar airspace opacity. This can be present in atypical or viral pneumonias. Chest x-ray findings in COVID-19 disease can progress quite rapidly.
As shown by this X-ray, which shows a much more severe disease. There's much more diffuse bilateral opacifications that you can see, and the patient is also intubated with a visible endotracheal tube seen on the X-ray. Typical COVID-19 findings of severe illness are those of a diffuse viral pneumonia, diffuse bilateral pulmonary opacities, which often become more evident as the disease progresses. Of note, pleural effusions have not been seen frequently in COVID-19 patients unless there is another disease process present. If you see a pleural effusion, consider alternate causes.
The chest x-ray should be considered in really any significant change in clinical condition. For instance, in an intubated patient receiving positive pressure ventilation who is decompensating, they should have a chest x-ray to check the position of the endotracheal tube as well as to check for the presence of a pneumothorax.
Chest CTs have been used significantly in COVID-19 patients, particularly initially in China. Typical findings on chest CT are those of bilateral ground glass opacities, similar to that seen in acute respiratory distress syndrome or other viral pneumonias. The chest CT has been found to be quite sensitive in diagnosing changes associated with COVID-19, with appreciable findings, even when the chest X-ray was normal.
However, CT scanning must be balanced with the difficulty, risk, and expense of performing this test. Transporting a patient out of the emergency department or ICU and away from resuscitation areas represents a risk to a critically ill patient. Additionally, the transport of a patient out of an isolation area also presents a risk to the clinical staff as well as the staff in the CT scanner. Therefore, a CT scan is only recommended if it really will change management and is really required clinically.
Bedside ultrasound is another imaging technique that can be used to evaluate critically ill patients without needing to move the patient out of the emergency department. Ultrasound can be used to look at the lungs for signs of infection or fluid overload within the lung. It can be used to look at the heart to see if their ejection fraction is still normal or has changed, and it can be used to assess volume status. This topic will be covered more fully in another session.
In general, most patients who are being evaluated for COVID-19 will start with having a chest x-ray performed. They may also have an ultrasound if it is available. If both are normal, no further imaging is really needed at that point if the patient is clinically stable.
If the chest X-ray and ultrasound are ambiguous, consider a CT only if it will change management to identify early COVID-19 infection.
If the chest x-ray and the ultrasound both suggest the presence of COVID-19 infection, before ordering a CT, consider the risk of sending a critically ill patient out of the emergency department, as well as the risk to the staff when moving the patient out of an isolation area. However, if there's any concern about the presence of an alternative diagnosis, such as a pulmonary embolism, a CT scan may be useful.
Your clinical assessment of a patient as being sick is always more important than diagnostic testing. Focus on stabilizing a patient first. An exact diagnosis is less important. Focus the initial testing on evaluating for life-threatening but treatable problems. Imaging can be used to suggest that a patient may have COVID-19 and may indicate that a patient has a high likelihood to get worse. Key findings on chest X-ray include diffuse bilateral patchy opacities in the lungs.